All right, hello. All right, so we are now recording. Just want to say thank you again, everybody, for joining us to BeHeard Colorado's community information session tonight. Again, just as a reminder, we are being recorded right now. If you do have any questions for us during the session, feel free. You can put it into the chat box here on Zoom at any time, or you could wait until the end of the presentation towards the Q&A section, in which you can feel free to take yourself off of mute and you can say your question to the group here. So without further ado, let's go ahead and get to our next person here who will be speaking. It's going to be Deidre Johnson. So Deidre, go ahead and take it away.
Thank you, Eric. Again, thank you for joining us tonight. Really, we're excited to have these sessions because we're working on a new project called BeHeard Colorado. And this is our way of kind of getting community members engaged in what we're doing and helping us to do it. The goal of this project, let's go to the next slide, is to support community leaders to be heard and advance equity in health policy. And if there ever was a timely moment to have this conversation, it's waiting for the results of the election earlier this week. We'll go to the next one. So BeHeard Colorado, it's a collaboration between the Center for African American Health and the Colorado Consumer Health Initiative. And really our goal is to not just partner with each other, but partner with community to bring ideas and solutions for health equity policy that are led by community. And this has actually been a long time coming. In 2016, the Center for African American Health started BeHeard Mile High, which is kind of our effort to start really getting a pulse on what our community wanted and needed so we could share that with others. And that's grown over time to a panel of over 1,200 people. And so we were fortunate to apply with the Colorado Consumer Health Initiative and receive some funding from a national funder called Robert Wood Johnson Foundation to really work to create an infrastructure throughout Colorado that what we imagine is just kind of waves of African Americans choosing to work on different projects to work toward health equity. And so again, we want to engage and learn, we want to champion and partner, we want to change policy for equity in general, but we want to do this not just saying, oh, we heard this from community, but arm in arm with community leading the effort. So we're gonna start with a little exercise, which will be, tell us your name, where you live, and most importantly, if you had a magic wand, what healthcare problem would you solve and why?
All right, so if I would go to first, my name is Eric Moore. I live in Aurora, in the Aurora Highlands, so right off of I-225 and I-Lift. And if I had a magic wand, the healthcare problem I would solve, so many. I think it's just the barriers for folks to get good quality care once they actually access healthcare services. So mental health, just the things like your length of the length of your interaction with the doctor, the quality as far as the experience you get as soon as you walk in the building, when you get out, and all the way to the end of the continuum of care. So just end to end, really just making sure it's something that folks enjoy going through and it's something that works well for everybody.
Good evening, everyone. My name is Chris Armijo. I live in the Denver Highlands on the opposite side of where Eric lives. And if I could solve one healthcare problem, is that, really getting health systems to think about health and healthcare much more comprehensively and thinking about everything that makes us healthy.
Hi, I'm Marie. And what would I do? I think my issue has always been there's a sweet spot for mental health for me. I would love for that to be normalized, for it to be like a regular checkup kind of thing without going through any rigmaroles to get people aid.
Thank you.
Hi, I'm Darla Ruff, and I actually have relocated from the Denver area, but I'm still involved and connected with a community initiative there. So that's how I got a hold of this invitation. I lived in Colorado for 35 years, and I actually just left the state in this past July. So if I could, so I now live in Smyrna, Georgia. That's where I am. But if I could solve a healthcare problem, it really would be the one that I'm currently involved in, and that's the health disparity for Black women, the premature births and the infant mortality. And I think it's really connected to what Eric said. It's the experience that they have from the very beginning of improving that experience of being listened to and being heard and being respected, that they know what's happening with their bodies and that type of thing. So that's what I would like to see different.
Good evening, everybody.
Everyone.
Ooh, go ahead, John.
I'm John Reed, and I live in Inglewood, Colorado, just south of the Denver metro area. You know, and if I could wave a magic wand, all of us would walk into our provider's office and see dozens of people who look exactly like us, providing the care to us. And go Georgia, roll on.
Indeed. Good evening, everybody. My name's Adam Fox. I work with the Colorado Consumer Health Initiative. I think somewhat related, if I had a magic wand, I would try to zap all of the sort of perverse incentives and profits out of the healthcare system. I think that would remove a lot of the problems that we have in the healthcare system and make it a lot easier to form a healthcare system that actually focuses on the needs of the people it's supposed to be treating.
Thank you, Adam. So I live actually in Southeast Denver, and I have to say, if I had a magic wand, I would use it to eliminate disparities. And yeah, that would be it. I'd go big. So let's go to our next slide, because I think we got everyone.
I would like to go. I was late.
Oh,
So
hi, Marilla.
Hi, I was late. So I was like, did everybody go? So I'm Marilla Chavez, and I live in Montbello. And if I had a magic wand, the healthcare problem that I would like to solve would be discrimination, because the toxic stress itself is a daily thing, and it can take its toll. I want to make it to 40 fabulous.
Well put. So one of the, and we've touched on it, you know, why focus on health policy and health equity? And we've got some examples up here, because we know that really for the past 10 years, we've been able to even measure, we've got a lot of data, we can even measure life expectancy by the zip code. But it's one thing to measure it, it's one thing to try to do something about it. And, you know, I'll use the example that was brought up earlier about maternal child health. You know, we know that Black women tend to die, we tend to die 4 times as much as other groups. If you're in New York, it's actually 12 times, which is kind of frightening. Well, it's all frightening. But when you drill down into it, you know, sometimes people will say, oh, you know, it was access, she didn't have what she needed, X, Y, Z. But they've really done the research, and we know that even if you control for education and income, same outcome. And so a Black woman with a PhD is guaranteed to have a worse birth outcome than a white woman with a high school diploma or without one. And a white woman who's carrying a biracial child will guaranteed to have a better health outcome, birth outcome. And really it goes to that toxic stress that you mentioned and the weathering that happens over the years. And it's interesting because, you know, sometimes people like to split us up into different groups and say, well, you know, is it African-American experience or an immigrant experience? That Africans who come here, after a couple years, all the same exact disparities. They're identical because they're in the same kind of toxic experience with regard to the things that we, deal with on a day-to-day basis. And so that's why we want to really try to work on health policies for health equity, because there's lots of programs we can do, but we cannot program our way out of this. We really have to work on those systems within which those programs live. Let's go to the next one. And this is, as of Tuesday, we'll need a new picture because we've got some new faces that'll be on here. But again, we have, even though we have representation in our entire House, we still only have 8 folks, 2 senators and 6 representatives. And, health advocacy organizations are rarely diverse or equity focused, and very, very few race-conscious policy solutions. And there's so many well-intentioned things that if you don't really look at the unintended outcomes, it's definitely, like a lot of people like to say, a rising tide lifts all boats, but that's not really true. If my boat has a hole in it, a rising tide is not going to do much for me. So really looking at what are those policy changes that can happen that are important to community that'll get us to that finish line of really shrinking those disparities and getting toward a state of equity. I will hand it off to Adam.
Thank you. So CCHI, we have been working in health policy for 20 years now. And one of the things that we know is if the people who are most affected by an issue are not present in the policy discussion, it's not going to change. And so we really want to lift up the voices of African American and Black Coloradans with policymakers through this project. Because without that influence, we're not going to really be able to change the health inequities that we know have been persisting for decades. We also know that one of the ways that is most effective is if those people who are most affected by inequities are able to share their stories and really be able to put not just numbers in front of legislators, but really contextualize the issues and how they are affecting people's lives. And so we want to bring together and organize leaders with shared experience with the healthcare system and make sure that those experiences really inform the policy decisions that are being made in our state. We really need to start thinking about policy in the lens of health equity and addressing health disparities. And this is one of the ways that we are really trying to do that in partnership with the Center for African American Health. You can, next slide. And as we already sort of talked about, our overarching goal is really that community leaders are the ones that are driving health policy change to improve health equity. Because I think it should really be the community that is most impacted at the forefront, and it should be the community leaders who are determining how policy is shaped, because as Deidre was talking about, there can be unintended consequences even if people are hypothetically have the right values in mind if they are not involving the communities that are affected. And so that's what we're trying to get at with this project. Next slide. We know that there's going to be a number of things that we need to try to build through this project with the community. And so the first being, we really need to build public will in and among members of the African American and Black communities for healthcare policy change, and make sure that those individuals know how they can influence the decisions that are being made. and really start building that political power and influence so that they can change healthcare policy. We also want to make sure that we're building up and supporting grassroots leaders who want to be involved in this work, and helping them really make the change that they want to see, and be at the forefront. And all of this is really to ultimately create a model for community-led change in healthcare policy. And so what we're talking about tonight really is trying to co-design with folks who are interested in advocacy leadership program that really helps build and support community leaders who want to work in promoting health equity and change healthcare in Colorado. Next slide. So what does this really look like? This is how we are thinking about getting the work done in this project. So as Deidre mentioned, the BeHeard Mile High panel, we have already done a survey of the BeHeard Mile High panel and broader community about what the community priorities are. And so looking in this graphic, we're sort of moving on to the next stage of really trying to design a leadership program that is driven by the community to support health policy leaders. And so we're going to talk a little bit more about what that means and how you can get involved, but that's where we are, and we are hoping that you all will be interested in helping us design what that leadership program looks like. From there, we'll obviously start trying to offer that leadership program to folks who are interested, and really start supporting members of the community to start this health policy work. And start creating really a coalition and working group that will ultimately determine the policy agenda and actions, and really start driving change at the state level, so that we can engage, we can make sure that we're addressing the inequities in the health policy process, and making sure that decision makers are responsive to the Black and African American community. Next slide. Now I'll pass it off to Chris.
So one of the other components of this that's really important is bringing some research to this work and bringing some data to really help sort of drive the agenda, drive the actions, and drive the change. So we have a part of the process that's called community-based participatory research, and that's really meant to be in service to community leaders and BeHeard Colorado participants, so they can really achieve their goals. So really what we hope to do through this process, through this community-based participatory research, or CBPR, is really provide timely and relevant information. So if the community of leaders really wants to learn more about birth outcomes, or if they want to learn more about disparities in quality of care, there's a research component of this that really helps to say, okay, what do we want to know? From where do we want to get the data? And what's the most useful way to use that data? So what we'll do is either focus groups or additional surveys, or just looking at what are other states doing? What is the research literature say? Just sort of trying to get data from all kinds of different sources to inform the group. And that serves a lot of purposes, one of which is to really increase knowledge on issues and really sort of identify those solutions. And more importantly is really to think about, okay, so now that we have an understanding of what we want to learn, now that we've learned it, now that we've identified both what frames those issues and the challenges those issues presents, but also what are the solutions, what we then want to do is really use those data to translate into actions and strategies for health equity to inform decision makers, to inform policymakers, and to form others who can really influence equity issues. And really the way we're thinking about it is, if you look at this graphic on the right, is let's together figure out what are the key questions we want to ask ourselves when we think about research or we want to think about data. And then once we're able to form those, really we want to conduct the research, whether that's focus groups or surveys, or just looking at what other states are doing. And then as a team, we come back together. This is both the BeHeard Colorado team that you've met from both Colorado Consumer Health Initiative and the Center for African American Health, as well as leaders that are part of the program. We want to share that research back and say, here's what we learned, here's what this state said, or here's what the survey said, and then really sit down together and say, okay, so this is what we think it means. Let's really sort of based on my own personal experience, based on my experience working with community, here's what this might mean, whether it's community saying that a particular issue is very important to them, or that they're experiencing, for example, discrimination in healthcare, which every survey will tell us, but that's just a really simple example. And then from there say, okay, this is what it means, this is what it looks like, this is how we want to interpret the data, and then again, translating that data into action. So we want to now talk to policymakers, decision makers to say, here's what we're learning, here's what's important, here are the types of policies and solutions that we have to make a change in a healthcare system or health overall to really start to achieve equity for our community.
All right, thank you, Chris. So hello again, everybody. My name is Eric. So now we're talking, now that you guys know a little bit about the project, we talk about kind of the significance behind all those steps again, that we really do make the difference as community. So when we think about just the components of it, it really is just a combination of our voice, our stories, and our solutions that we offer to help create that change for health equity. And the voice, of course, is needed to create health equity. As an individual, in particular, we have a vast amount of information that we can share with others about our experiences, about our backgrounds, and what kind of interactions we're having when it comes to dealing with a lot of the healthcare issues that we see. So us really being able to make sure that we can formulate our own voices is the first step, making sure that we feel empowered. So with that, it's really just, with the BeHeard project, it helps with making sure that individuals can come together who have voices that they want to strengthen, that they want to share in the effort of solving some public health issues. And we do that by creating stories. So stories, it kind of touches on what Chris talked about the data piece, and also what Adam said about contextualizing our experiences. Our stories are really just the way that we communicate our voices. So understanding, how do we formulate that story? How do we use our own personal experience? How do we use data that we conduct that others have already done the work for? How do we actually formulate that into stories that will grab other community members who are interested in this effort, that will grab the ears of policymakers and decision makers in our city, in our state? So, those first two are very vital, and that's something that we hope to really build up. In the next piece, we'll talk about a little bit about the design team when it comes to creating this leadership program. But we're hoping that through BeHeard project, through folks going through the leadership curriculum, they can actually help with creating those solutions. A lot of us have opinions already about what we think should be done to solve a lot of the issues that we see. But this project is really a way of making sure that we can do it in a collaborative way. And in strength, we do have, our strength is in our numbers there. So with our solutions, we can use data, we can use the ideas and the experiences of others who are also interested in this to really make sure that that's something that we can communicate out to the decision makers and policy makers that do impact us. And again, with all those, our voice, our stories, and our solutions, we can use that as a vehicle to create health equity change that matters to us. And it really does start with being community informed and community led ultimately. When it comes to just the sustainability piece, community has to make sure it keeps going. Something that Adam's mentioned in the past is that a lot of initiatives that have started when it came to bigger entities and institutions working with community is that sometimes they'll cap out. At a certain point, money runs out, decisions stop being made, leadership changes, and things dissolve. And that's something that we want to avoid. And the only way we know that we can do that is by making sure that we design a program that is going to be informed and ran by community and is sustainable into the future, well beyond any of those other factors when it comes to who started it, where the money's coming from. It's something that can still be continued going forward. It's a legacy we can leave behind when it comes to actually advocating for the change that we would like to see. Next slide, please. So to talk about the leadership curriculum, we are, again, with community being community-led, it has to be from start to finish. Community is a vital stakeholder in all parts of the work that we do when it comes to impacting health policy. So we want to make sure that from the beginning, even before a program is created, it's created with community in mind and at the helm of it. So there's 4 steps really with being part of the design team when it comes to making this curriculum, is that we're going to collaborate, design, recruit, and learn. So to collaborate is from other community leaders. When it comes to that, it's really just working together with people who are the ones that can give us this perspective and give policymakers that perspective that needs to be out there. Policymakers and decision makers, they will see what they see. They'll see the data they see. They'll hear the stories and testimonies they see. We have to make sure that our story, our data is being put up in front of them so that those decisions can be made. So we have to make sure we collaborate with other people in our community to be able to do that. And community leaders, again, we're all leaders. We all have areas in our lives in which we have to take responsibility and we put work into to get certain results out of. And as community members, you are a leader. And that's something we really want to define in this program, is to make sure that when it comes to community leaders, we're not just thinking, although it does include, of course, people that might be considered leaders in your faith group, people that may be considered in the local business sector, that might be leaders in mentorship programs, and those who work with youth, or those who work with community members who are hardest struck when it comes to some of the needs that are needed, especially during COVID. When we think about people who run nonprofits and food banks, something that we want to make sure that we understand that everybody has a voice to share here. And that's one part, and ensure that we want to make sure everybody has the ability to do is to work together on this. The second step is to design the curriculum, mainly to raise awareness of the issues that we're worried about and to create action for health equity and health policy. It really is that these first two, collaborate and design, are really the participatory part that you'll see right off the bat, is that really it is about community members rolling up their sleeves and getting into the work, that we are co-designing this. Of course, you will have support of people who are in health policy, people who do programmatic work, people who do work directly with policymakers. But we want to make sure that that's something that is not going to be overshadowing. When it comes to a lot of collaborative spaces, there's always the issue of power versus authority. When it comes to power, usually the people who have the power are really going to be the people we assume when it comes to who has the money, who has the infrastructure to create change. And when it comes to authority, usually it's going to be the people who can actually have the insight to actually solve the problems. And those are going to be the community members. We know what's happening at our level. And it's up to us to make sure that we can help maintain that balance of those who have the power, that are some of the bigger institutions that impact us, and those who have the authority like us. So that's something that we want to make sure we do. And that really helps out when we go to the third step, which is to recruit other community members in this effort. Again, we need people who have diverse backgrounds and experiences and have the motivation to want to work on some of these issues independently, but also collaboratively. We want to make sure that that's something that we're doing. So we hope that we can really inspire folks to be able to want to join in and help keep designing this curriculum over time. We want it to be iterative of each other, that every time a program, a cohort of folks go through the program, we are learning from the people who just came out, and we're making sure that the next people who come in are going into something that's more improved, something that's actually informed by the people who passed before them. So that's something that we really make sure that is understandable, is that even in that you have the ability to design the program. It doesn't end when the curriculum is created. And then the last one is to learn from each other, and particularly for us to help create action and change. And it kind of goes back to what I just mentioned, which is that people who go through this program will help inform us, and we will learn from them as far as what they went through, how they can apply the things they learned, how they stay connected with us and other people who come out of the program as well. With the sustainability piece, we don't want it to be something where people feel like they have to tether onto our 2 nonprofits forever to continue doing the work. We want it to be something that folks can actually be their own advocate and be community champions in their own right, and something they can do independently of us. This project is really a way that we can make sure that we can understand what community wants, we can give community the pathway, and help them see new ways in which they can create their own pathways. We don't want people to feel like they have to follow a certain idea of how community advocacy works. We want people to be trailblazers. We want innovation. We want creativity. So we want to make sure that folks can have at the base level what's needed to kind of get started. And we hope that people will continue doing work with us going forward. Next slide, please. You know, with, well, I guess before I start on this part, I would like to just say, you know, with that last slide, just a question to keep in mind is, how do you see your own role in protecting health for yourself, for your family, and your community? So it's just something to reflect on. We started this off by talking about some of the healthcare issues that we would solve if we were able to kind of just, you know, swing a magic wand and poof. But that's a constant reminder for ourselves, and it's something that we think about a lot when we think about how we lead our families, how we lead our own lives. So something just to keep in mind. Oh yes, sorry, Chris, can you go next slide, please? Okay, so some details about the design team. So again, this is facilitated design process. We want to make sure that this is something that we can come to, we have a set place and set time that we can decide all together to be able to be part of this. So it's something that we'll be able to guide each other through and making sure that we have all the components of the curriculum set in place before we even start to work into it. And it will be made up again of people such as ourselves, CCHI, other community leaders and partners that are interested in being involved in the work as well. So it'll be people with a wealth of different expertise and experience being brought into this process. The expected time commitment is, actually, I think we have it adjusted now. Sorry, we did adjust it. It's 6 to 8 meetings of about 2 hours each. And the 6 to 8 really just allows us to have the opportunity to make sure that we're being thoughtful about what we're creating. And again, this is something that we get to decide. So what we're trying to do now is understand who are interested in being part of the design team for the leadership curriculum. And then we can actually set a time in which we'll meet after the holidays to actually be able to start doing that work. So we want to make sure that it's something that's flexible and works for everybody. And that people who are interested can actually be able to stay from start to finish in helping design that. So again, 6 to 8 minutes, about 2 hours long. It will begin after the holidays. And as far as some financial incentives, we are going to make sure that folks get stipends for participation. As of right now, we know a minimum, it would be about $50 per session at the very least. So we want to make sure that people are incentivized for their time, and we hope that it's something that folks would create. They would create something and that they would themselves would like to go through, and they would like others who are interested to go through. So we want to make sure that it's something that really is owned by community. You know, with the recruitment piece, I'll just mention, you know, a lot of opportunities there for the sake of, you know, developing your own leadership skills. This is something that allows you to be able to learn, of course, some of those skills that folks use when it comes to leading and working together with others on big projects like social change issues. But we want to make sure that it's something that folks understand is that they really do have the opportunity to lead in this work. Another one, again, is the skill of development. You'll learn a lot about policy and how it works at the local and state level. Learn about some of the actual methods that folks use to do organizing at the community level and what they need to bring to policymakers and decision makers to influence them. So there's a lot of opportunities in which you'll learn how to be able to effectively communicate your issues and your story to folks. And some of that will be a lifelong skill that we hope folks will be able to develop and take with them. And then, you know, finally, again, the financial incentive of everybody will be compensated for their time in this design process. Oh yes, next slide, please. And then that's it for the presentation today. You know, again, we summed up that there is, of course, a need for health equity issues to be addressed, particularly when we think about our community. Is something that we have a lot of things that we know that we want to address. And then, you know, we talked a little bit about how this actual project works when it comes to designing the end-to-end work. How do we actually start doing our initial research? How do we actually work together in collaborative settings and mainly in that coalition that Adam mentioned? And then how do we actually make sure that we're taking it to policymakers to affect change? And again, creating that circle. We're always trying to inform of what we've done. So we just don't take policies to policymakers and what happens, and we let it lay there. We make sure that it's going to continue being something that we can grow upon. So I guess with that, you know, is there anybody here who has any questions in particular around the leadership design team or anything around the project itself? And if you do, feel free, you can put chats in the question here, or you can go ahead and unmute yourself. You can take yourself off a video if you'd like to, and you can ask us directly.
Go ahead. Go ahead, Mel.
Go for it.
No, go ahead.
I was just going to ask, what is your overall timeline for this? And I guess just for like kickoff kind of thing. I know it's going to begin after the holidays, but what do like the frequency of those meetings look like? Is it just kind of going to be based off of what happened in any particular kind of meeting? It kind of sets like how quickly the next one has to happen kind of thing?
I think one of the things we discussed was once we have that core group, really letting them decide the frequency that works for them, given what's going on in their lives, if they have kids, etc. But the project itself, this is a 2.5-year project from the standpoint of RWJ. And so really our goal is to use that time to create a small movement that kind of keeps going on its own just because of the energy and creativity and the ownership by community.
Oh, and if I could say, I'm sorry, I don't know if it was mentioned earlier, RWJ is J at the Robert Woods Foundation. Sorry, Robert Wood Johnson Foundation. I should probably get the name right.
The same, like, oh God. I know who you're talking about though.
Hi, everyone. I had to hide my video because I'm eating my dinner, and I didn't really want to be. But anyway, I just had a question. So since I'm not in the state, I still have children there. My grandchildren are there. May I participate in this project? Because I'm in Colorado, I'm in Georgia now, as I mentioned. So I'm not sure. What do you think about that?
You know, I think that's a good question for us to go back and noodle on.
Yeah, I mean, I lived there for 35 years. I just recently relocated, so let me give that as a
And you failed to mention that you are part of the Black Health Initiative here still.
Yes, in Colorado. I'm still involved in that because we're doing everything remotely, so.
Very true. That's a good point.
Yeah. Like
Think
just
about that. Chew on that and let me know what you think.
Yeah. The other thing that's kind of neat is, so there were only 6 grants made under this effort, and one of the other ones is in Georgia.
Where?
Atlanta?
Yeah. They're doing a lot of community health workers.
Yeah, and that's been the one thing we've talked about even with our BHI initiative is trying to create some connection across the country, like some sistership, you know, some partnership. Like this is our sister organization there. Like really working at trying to have that sense of community, even though we're that far apart. And certainly this time of COVID has taught us that we can actually do that with Zoom and these other platforms.
True.
And Darla, you know, you did mention that you have children and grandchildren in the state. You know, if they are interested, you can always refer them to the project as well. But
Absolutely.
We'll definitely get back to you on your question about that.
Yeah, and I will pass this on. Are you all going to do any more informational sessions like this?
Yes, we do have one more. It will actually be, it's on a Thursday. It's the
18th, did we decide?
Okay, I'll pass this along to the young folks that I know that are involved in health there. I don't know if they've gotten this information or not.
Okay, that's perfect.
That's what we're trying to do, multiple of these to kind of spread the word.
Yeah. So I'll pass it to my network there.
Yeah, we decided lunchtime to kind of catch what's during the day, because sometimes evenings are hard. Noon on the 18th.
Okay.
Yeah,
all right.
I'll make sure that that's something that's in our follow-up email to tonight's session to everybody registered is the actual Eventbrite page for that. So you can always share it with them and they can register and do just like you did for tonight, and they can be able to access the 3rd session. But yeah, great question. I'm glad you mentioned that. That's a good one. I think that when we think about influencing policy from folks who don't currently live in the state they're trying to influence policy in and may have left, you know, just what they have as far as the experience and stories and, you know, that they can still generate. So that's something that definitely we'll get back to you. We didn't really, that's you threw as a curveball. We weren't thinking about that. You really did. I was like, I'm gonna let Deidre answer this Because I was like, I don't know, actually. We never discussed that. But we're glad that you're still interested and very involved still with health equity here in Colorado. So thank you, Dr.
Yeah, yeah. Well, I definitely have. I have 8 grandchildren there growing up there. So I have a vested interest for sure.
I was about to say
That's wonderful.
investments. Well, I guess anyone else had any questions around this? We'll make sure in the follow-up email there'll be some more info that you guys can, of course, share with others about the project. If there's anyone that maybe pop up in your mind as far as being part of this project. Any questions?
I have just one. Speaking generally, what are some of the topics that we might be discussing in these meetings?
Yeah, I mean, really, it's community-led, so it could be anything that indirectly or indirectly affects health. If it's something when it comes to, again, when we think about policy, it could be anything that can impact that. I mean, if it's prescription costs, if it's access to care, if it's health insurance, anything in particular that you want to, that's what we're trying to really learn from folks. In our survey, our health priority survey really helped us start to kind of understand what people were looking at. But really anything that we want you guys to tell us what you would like to cover.
Okay, like for example, one of our biggest concerns is the biases, the implicit biases walking into a hospital or medical facility. Do you have someone who could speak to that?
Yes. I
Okay.
think, there are a couple, it's kind of a both and. So like Eric mentioned, we're really focusing on the social determinants of health. So everything that goes into that. And the other nice thing, we've got so many different partners that if that's something we want to take on, and it's kind of things we've been talking about with Colorado Medicaid and other providers, as an organization, we're getting ready to embark on some work with Denver Health. So I think once you take, it's one thing to have those little projects, but if we or the group decides, we want to work on bias in the health system, or we want to work on some aspect of some other aspect that informs health. It's all valid.
Put it all
Just
on the
push
table. Okay.
Yeah, whatever you want to put your energy behind.
And I was going to also add, Mary, hi, Adela from the Colorado Consumer Health Initiative. We've also put together just a list of topics that we can start to work from as we design an advocacy leadership training. So that's part of the initial process, is to have a community designed advocacy leadership program that we put forward, and then through that process identify the issues that community wants to work on advocating for. So we're not totally starting from scratch. We do have a little bit of a foundation, and then a network of folks that we can bring in to serve as trainers.
That's great.
And to add to what Adela said, when it comes to data, the data that's available to us when it comes to racial equity along a lot of these issues, we can feel a certain way about it if we don't feel like it's pointing enough to what's causing some of these disparities. So we want to make sure that, of course, that we can inform people who are part of this program when it comes to the data that's out there, but we don't want it to be something that people feel like they have to conform to. There might be data points that you're like, well, I don't really want to work on that issue, but that's really all that people are talking about. Let's go with that. We want to make sure that it's something that, again, solves an actual problem. So if it's something that there's not research that supports it, that's why we could even conduct our own research when it comes to making sure we create that change. So we want to make sure that we can still back things up with our data, and data that we create, data that our organizations have compiled that are in the state of Colorado, nationally as well. So we do want to make sure that, yeah, you don't feel unsupported or feel like you kind of have to start from point zero on these things. There's lots of things that we could cover, and we'll tell you as much as we can, and hopefully that's something that will inspire from there as far as how we design it.
Yeah, speaking of Georgia and connections and working nationally and connecting the dots, I recently was able to catch up with someone I hadn't seen in forever, who she's located in New Jersey because she used to work at Rutgers. And 2 years ago, she started the Center for African American Health Disparities, Education, and Research. And she's just a research thought tank. And we were just brainstorming some things we could do in the future. But when you think about someone who, in their heart, is in the work of our community, she was sharing things with me that, even with COVID, she recently did a study around seniors in congregate housing. Not only are our seniors having issues, but our Alzheimer rates are skyrocketing, because when you're that isolated by force, it accelerates the process. And it's those little nuances that, unless you were looking for it and had, you know, your eye on what's happening to Black elders, you wouldn't really know. And she's done a variety of things. So we're going to see how we can partner more with them as well.
And I think that's great that what Deidre mentioned as far as like how we partner with other people, even across the nation. And that's something where we want to make sure that in the leadership program, we can have it where folks can hear from people who are experts or speakers in their respective areas as it's needed. You know, if it's something that's the folks who are designing the curriculum, who are in the curriculum, say, if we want to talk to somebody in Colorado that deals with this issue, we want to hear from them. We want them to give us some information and answer our questions. That's something that we want to make sure that we can connect folks to those kind of leaders when it comes to just who are people that can actually sit and talk to us, help us formulate some of the strategies that we want to employ.
Up on a Zoom.
Yes, yeah, that's good. Yeah, more Zoom invites, but you know, that's just the nature of what we're doing now.
It makes the globe very small suddenly. So
Yes, it does. It has. Mm-hmm.
Well, I mean, was there anybody else who had any other questions? We still have quite a bit of time. We have 12 more minutes. If there's any other questions, feel free. I don't see anything in the chat right now.
I have another question. So as far as like participants and being involved, when you say you know, it's the representation of those communities, is it specifically those who identify as being Black or African American, or those that identify with being mixed? You know what I mean? You know how it can get kind of messy there. Is that like a requirement of who should be participating on either end, as far as like a expertise level, and then just kind of like that community leader, boots on the ground kind of person to
that's
help
a very good question. You know, at the center, I typically say folks who identify as African American. But you know, I think for this purpose, the ultimate goal is not only to create leaders from the community of both mixed and it's funny because, you know, so many of us have families that are rainbows that I don't even, like, if someone attends to identify, we just go by that. But knowing that we're working also to really do something about the policies that are creating such ongoing historic barriers, and a lot of this is getting to the root cause of racism. I do see it as a broader effort. So like, nobody's gonna say, well, you know, you're not Black enough. That would take me back to grade school, actually. But yeah, so I don't know. What are other team thoughts?
Yeah, I mean,
another good question that we hadn't anticipated, actually.
Yeah, and Deidre, I think you broached it extremely well, and Mariella, thank you for being on this call. You know, my idea of it is that it is broad and it's all encompassing. You know, because at the end of the day, you're dealing with injustices, systemic racism, and barriers that are in people's way. And you know, and recently we're trying to reach solutions, you know, for issues that confront our community from multiple angles. You know, and I'm sitting here with, you know, looking at you and thinking about the oral health barriers that are endemic in the African American community, and how 5 or 6 years ago, community health centers championed through the Affordable Care Act to get, you know, that oral health expansion through Medicaid, where they had $1,000 allocated a year to be able to get prevention and treatment, which wasn't necessarily there before, you know, where maybe the remedy was to have people's teeth pulled. And that's
that wasn't there. That was
pardon?
the remedy. No,
Yeah,
before
it
that
wasn't.
change, it wasn't there.
Yeah. So that's my thought is it really needs to be broad and all encompassing, you know, and who's really to say um, who's a champion of change and change in the legislature and who's not, you know,
Well,
is my
the other
thought.
thing is, oh, sorry, that, you
Yeah,
know,
I'm done.
the grant as written was um, having more African-American advocates
There
and
you
kind of
go.
having the waves. But, you know, no advocate works in isolation. So I think it's just it's a good way for us to think forward how we can keep on point, be inclusive, and still, because there's a lot of work to be done.
And if I could just add, Deidre, I think that was great as far as you mentioning that, you know, we're all multifaceted. No group is a monolith when it comes to being identified as Black, Latino, anything. You know, and so I think it is important for us to be able to allow people to, you know, allow that inclusivity when it comes to all the different facets of who we are as community members, but particularly when we talk about bringing more Black African-American advocates through the program. We want to make sure that folks can self-identify, and it really has been how we've done our research as well. Usually systems of oppression, the classification is done, of course, by the people who dominate the systems. So they get to say who or who you're not as far as what party and, you know, who, if you belong to the party or not. But that's something that we don't want to do within our own community. It just causes more derision, and we're not going to have the unity that we need to be able to address a lot of these health issues. So we do want to make sure that's something that folks don't feel threatened by when it comes to being involved in this work.
Great, thank you. Yeah, that's just something I kind of definitely wanted to make sure, you know, as sharing this and speaking to it, just able to say, yes, you can, you know, join, it's all inclusive, but considering the rhetoric of today, it can definitely be intimidating where, you know, people don't want to seem like they are the savior or stepping on anybody's toes. And so I wanted to get your guys' blessing as well before I, you know, said, yeah, sure.
No, please spread this. Please, we'd actually love for you all to spread the word, because that's what these information sessions are about. Because we imagine we only really need a core group of, you know, 6 to 10 folks in the design phase. And then the real push will be, okay, we've built it. So really getting the word out and then working the program. And then 2 years from now, we'll have, you know, 1,000 graduates. And lots of change.
That's on our list. That's on our checklist. Well, was there any other questions tonight? Anybody had? If not, you know, feel free. I'm gonna make sure that our contact information is here in the chat. You know, we'll be in a follow-up email as well, so you can always reach out to myself. You can reach out to Adam Fox as well regarding the design team being part of that. And if you're just interested in being part of the BeHeard panel itself, or have more questions about that in the survey research we do, you can always reach out to me as. Let me fill that in there so everybody should be able to see.
So Eric, can you send us a copy of the presentation as well? Is there a link to it?
Yeah, that should be fine. I don't see any disagreements around that from the team. So yeah, we can make sure that that's something that's included in the follow-up email along with a link to this recording.
Okay, that'd be great.
Yeah, and feel free to share it with folks. We want to make sure that people can see this. We've done one session already, and unfortunately, my internet was botched the recording. So this is our go. This will make it into the email this time.
Okay.
And we're you know, I for one am really excited about this, because oftentimes folks say that it's community informed, but it's really not. It's someone's been given, you know, something that like they think is turnkey. We really want to co-design something with community members that long lives after we've, you know, moved on to whatever our next gig is. It really has a life of its own.
All right, well, we are actually only 3 minutes short of our end time. So if there's no other questions, I do want to thank you all again for attending tonight. We hope that you'll spread the word about BeHeard Colorado project. And if you have any questions, again, reach out to us. But either way, expect that follow-up email from me shortly. Thank you so much.
Thank you guys. Have a good night.
You guys as well. Take care.